The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And it must be Friday, and indeed it is. It is Friday, September 18th, and we're happy to be coming at you live from the Scottsdale Air Park studios, from Money Radio, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this is the first time you're tuning in, our show is about how our older adult population can live a healthier, happier life. And how do we do this? We do this by bringing extraordinary guests to the show. And today's no different, especially when it comes to how our older adults can live a healthier, happier life. I'm really proud to have in the studio. They were just here about 7 months ago, 6.5 months ago. Nicole Holtsclaw, she is the membership counselor for Sun Health at Home. And I've got Barbara Mason, VP of Home and Community-Based Services for Sun Health at Home. Welcome, ladies. Good to have you on the show.
Thank you so much for having us back, Bob. You're such a great friend to Sun Health, and we're always happy to be here to tell you what's happening.
A lot has happened since you were last here. You were here February 28th, 2020, before the whole world came crashing to a halt and we had stay-at-home orders. So
it's like a whole nother world.
Like another world, Nicole, and I'm just dying to know what you guys have been doing and how have your members been surviving through this whole new paradigm that we are in?
Well, I'm happy to say we have, between all of our 3 CCRC communities, our life care communities.
Can you tell us who they are so the
Yes.
audience knows?
So Sun Health has 3 life care communities, Grandview Terrace in Sun City West, the Colonnade in Surprise, Arizona, and then La Loma Village in Litchfield Park. And then our 4th community is Sun Health at Home, our community without walls. So all of our members live in the greater part of Maricopa County. Really, we cover all of the West Valley up into the Northeast Valley. And among all 4 of our communities, we have had 0 COVID cases.
Whoa, that's so awesome to hear. And you know what? It doesn't surprise me. I mean, when you really sit down and you think about this community that was built in Sun City when Del Webb built that, I mean, it is a self-contained unit. You guys have a great partnership with Banner.
We do.
And you guys have really done a yeoman's job. Hats off to you guys. And Joe LaRue and his whole team as well. I mean, amazing that you guys have been able to accomplish that.
You know, it's been a heavy lift, obviously, for everyone. But I think we've really risen to the occasion. We have improved our processes. We've developed new processes. And really, overall, I think we've just stepped into the future as everyone has had to do. We've done that, I think, with grace. And really, the effects have been, although it's difficult not to be affected by COVID, we've kept that to a minimum for our residents and for our members. And we've all done a great job with their help, keeping everyone healthy.
Yeah, and keeping that communication, I think, between our members and our staff and our residents and our leadership teams. That's been a big part of it as well.
Well, and let's face it, communication is the root of everything. And you've got to stay connected. And the beautiful thing is, through all of this, we have found new ways to be connected. We were talking about that before the show, and that's made it even better. But at the same time, I don't want to minimize your accomplishment, and I think you guys realize it too. I mean, we're all going to experience COVID at some point in time, and the key is to isolate it once you get it and to self-contain it so that it doesn't spread. But kudos. I mean, we've been at this for about 7 months now, and I don't know of a community that has that record that you guys have. So, and I also love the fact that you look at Sun Health at Home as a community unto itself, and it's the larger community, the community without walls.
Yeah. And it really is a community in every sense of it. It was designed to be that way. So when members first join Sun Health at Home, there's nothing changes in their environment. They stay in their own home. They maintain their lifestyle as they did previously. But the biggest difference is now they have the support of our staff and all of the knowledge from years of working in healthcare that Sun Health offers, as well as now over 100 members to connect with. And COVID has changed some of our ways to help members connect since we haven't been able to get in touch in person. But part of that community is being able to reach out to like-minded people and share things that they can connect with outside of what's going on in the news.
Right, right. So for our listeners, those that don't know about Sun Health, I'm looking at you, Barbara, you or Nicole. Can you give us like an executive summary about how Sun Health all began and really the origins or the beginnings of Sun Health at Home?
My pleasure. Sun Health actually started out as a hospital organization over 50 years ago. And at that time, we were the builders and the operators and owners of Banner Del Webb and Banner Boswell hospitals. And at that time, we also had a health insurance plan, Sun Life. And so some folks are very familiar with that. In fact, they'll come to us and say, oh, I still have your insurance, although that's morphed into a Medicare Advantage plan at this point. But so we started out really interested in the health care of our community, of our senior community. And as time went on, we really decided that we felt like we made a great impact. We wanted to make more of an impact. And so we did sell the interest in those two hospitals to Banner, who successfully operate those at a high level at this point in time. But we wanted to still stay a part of our community. So we changed our focus to making sure that folks were able to age successfully, to enjoy their retirement years. And so we purchased and we still own and operate 3 of those CCRC, Continuing Care Retirement Communities, that Nicole was mentioning, as well as our at-home program and many lifestyle change programs as well. And we also own and operate the Center for Health and Wellbeing, where we provide education and support for folks who may want to improve their nutritional status, that they may want to address their diabetes or pre-diabetes. Maybe they want to have a massage or some acupuncture or take some classes in Tai Chi and yoga. We provide all of that in order to help our folks who are enjoying their retirement enjoy it in a healthy manner.
Yeah, I like to think that we excelled for many years at treating and addressing acute care needs. And when we made this shift into senior living and wellness, it was a true shift in mindset as well. Instead of treating those acute care needs, we were taking a step to address them before they needed hospital treatment, that acute care, by providing the education and providing the support someone needs when they're newly diagnosed with a chronic disease, and really allow them to help manage it so that they never hopefully need to go to the hospital. They can manage it with our support, their physician support, and new knowledge.
And I like to refer to that pre-acute.
Pre-acute, I like it.
So it's the pre-acute connection with your community. And at the end of the day, it is really about the community, right? I mean, you guys are a fixture in that community. I mean, Del Webb built this over 50 years ago, and it exists today. And Sun Health at Home really is, the origins of it is the community. It's hard to believe we're down our first segment. We got about 30 seconds, but I do want to say that I am just so impressed with the Center for Health and Wellbeing and the memory care navigating programs. I want to get into that in the second segment and really talk about what you guys are doing in that community. I've actually witnessed some Tai Chi classes that were being held, and all of this stuff is free. It's free to the community, right?
Yeah.
Do you need to be a member of Sun Health at Home, or?
No member. Our fitness classes have a very nominal fee, about $5 per class, but majority of the education series are free.
Wow. And the education series are around some of these morbidities like diabetes. And we can't get enough education relating to that.
Exactly.
Well, you're listening to Health Futures Taking Stock in You. I am your host, Bob Roth. I've got Sun Health at Home here in the studio. I have the pleasure of talking to Nicole Holtsclaw, and I got a chance to talk to Barbara Mason. Stick around. We got 3 more segments. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're on our second segment. And we've got Sun Health at Home in the studio. I've got the pleasure of having Barbara Mason, who's the VP of Home and Community-Based Services, and Nicole Holtzclaw. She is the membership counselor at Sun Health at Home. And I got sitting in the audience, I've got Paul Bowles. He is the program manager for the Sun Health at Home. Welcome to the show, and it's really good to have you ladies here, and you, Paul. And if you missed our first segment, go up to our website at cypresshomecare.com, click on the media button, third button down is radio shows. You'll catch that first segment and probably about 300 or 400 others that we've been bringing to you for nearly 8 years. So when we left off on the first segment, we were talking about community and how Sun Health at Home is part of the community. And it's always been Sun Health has been a part of the West Valley community. But, you know, you mentioned how, Sun Health at Home is one of your communities, one of your 4. But this one is Maricopa County without walls. And you have lots of clients right around here, our radio station here in Scottsdale. I mean, you have clients here, you have clients.
We are actually leaving this segment with you and heading down to a little further south in Scottsdale to sign 2 new members.
Love it. Absolutely love it. And I think that's, probably a challenge that you've had to overcome, because you've got that Sun Health label and people think that, oh, that's Sun City. That's not really here. But you've overcome that by really gaining lots of members. I had Jennifer Drago here on the show probably about 4 years ago. I could look it up. When she started talking, I brought her on to talk about this, and there were less than 10 members then, and you guys are well over 100 now. That's amazing.
Thank you, Bob. We're so excited because when we started Sun Health at Home, the idea was that we knew that up to 90% of people over the age of 70 don't see themselves leaving their homes. They don't really see themselves moving into a retirement community, no matter how beautiful it might be, and no matter really what the amenities are. They're happy in their homes. And so we wanted to make sure that as we brought Sun Health at Home into the area, that we appealed to everyone across the valley. Because no matter where you live, if home is where you want to be, we're able to help you successfully achieve that. We know that statistically, 96% of folks across the country who have joined a program like Sun Health at Home have in fact stayed in their home until the time that they didn't need it anymore, so to speak, right? Mm-hmm. And so 96% of those folks have been successfully able to age in place and receive all of the support and all of the benefits that they would if they had in fact moved to a retirement community. So we've been happy that we've been able to service the people across the valley, and that we don't have the restriction by saying you have to move in with us. We really move in with them, so to speak.
I like that. I really do. And Nicole, I'm going to bounce it over to you because I understand Sun Health at Home. Mm-hmm. And I want to try to help you explain to our listeners we've talked about it being, without 4 walls and this community, but what does a member get, and how do we sign up for this? Our listeners here are really fitting that demographic that you are looking for. This station attracts people between the ages of 35 and 70, and typically most of the people here have money in the markets, so they have means, and they're watching the stock market, and they're listening to this show because they want to know what's going on. So please share with us what exactly is Sun Health at Home?
So Sun Health at Home is a hybrid of the best parts of a continuing care retirement community, that sense of community and the healthcare protection and the healthcare know-how with the benefits of a long-term care policy. So in long-term care, it's designed to help protect your assets from the inflation cost, the growing cost of healthcare, right?
Right.
So our members get a benefit amount set aside every month that they can use towards their benefits for in-home services or facility care if they needed it. But the primary focus is wellness, prevention, and in-home service. And then it is that community aspect where we still want to engage folks. So we still offer ways for them to connect with others and engage them intellectually, socially, physically, and having that holistic approach. Wellness. Wellness is this buzzword that I think a lot of people have used.
Right.
But in our program, it's more referenced into this holistic aspect, looking at every aspect of someone's life that plays into their health. And so it really is a tool for folks that are pre-planning for the future. So before they actually need care set in, it's the perfect time to learn more about the program and look into joining, because most of our members are required when they first join to be independent, so not in active need of care. And then we essentially age with them and help them do so successfully.
So do they have to have a physical? Do they have to go through all of that to qualify? Like you would maybe to buy life insurance or long-term care insurance?
Well, I think I'll take that question because, in fact, I am a member of Sun Health at Home.
There you go.
And so as I was directing the program, it really became clear to me that I meet the demographic, and I didn't have I'll say a solid plan for my future. I wasn't able to obtain long-term care insurance due to my diabetes diagnosis. And so what was I going to do? It really was an easy process. I filled out a medical qualification form, didn't need a physical, didn't need blood work, didn't have to have a doctor sign off. They merely collected some of my medical records in order to be aware of any chronic problems that I might have, like my diabetes, and prepare for that as they were going to step in and care for me if I needed it. And in addition to that, they collected some financial information from me to make sure that, as Nicole puts it, I think it really is about making sure that we don't create any obstacles for our members, either from a medical standpoint or a financial standpoint. Because our goal is to protect not only the physical and health condition of our members, but to protect their hard-earned assets as well. So it was a very easy process. It took less than 30 days for the underwriting process, and I'm a full member, knowing that for the rest of my life, I have a life care program that is going to be with me no matter where I go or what I need.
So, question for you: were you able to keep your doctors?
Absolutely. So we really partner with our members in their own decision making.
Good.
We call it your plan because it is your plan. So I kept all of my doctors and my hospitals. Now I just have an advocate and a communicator. I have an RN who will attend appointments with me, who will advocate for me, who will make suggestions on how I can better take care of myself. And that's really what we do for every one of our members.
Wow. So that advocate helps you be accountable.
Oh, you're not kidding. and even though I'm technically the boss of those advocates,
right.
Trust me, they turn the tables on me.
Well, it's kind of like having a coach, and you know people go to fitness classes so they can be told what to do. So you're being told, this is what you need to do to have better health.
Exactly.
Especially with your autoimmune issue with diabetes, and I'm sure that they are riding you and staying on top of you, and you probably are communicating what your sugar levels are,
and I'm behaving.
You are good.
And I also have the assurance that if sometime in my life I am without a spouse, that I'm technically on my own, that I'm really not alone, because I have someone who cares about my health, who cares about how I'm doing emotionally and spiritually and physically, and that person will be beside me no matter what I'm facing.
So you mentioned life without your partner, and all of us, can't imagine what that might look like. But God forbid that were to happen. And let's say you moved out of state because your children or somebody was over there, lives in, let's call it, Washington State.
Yeah.
What happens?
You take Sun Health at home with you.
You take it with you. You still have your advocate, your coach.
The same coach, the same wellness coordinator, the same team.
Wow.
So we actually had members about a year ago move to New Jersey for just that reason. They wanted to be closer to their kids
Right.
and their grandkids. And they took their program with them. They have used services, and they essentially get another physical in-person coach that is able to be there. But really, we're still there to support them and help guide them through any issues that may come up. But that's the best part of our program is it's not designed to be this big permanent decision that you're making in the next stage of your life.
Right.
It's a step in planning for your future, and it's so versatile and it's so flexible that it really does allow for things to change.
So hypothetically, as we get ready to wind down, I know we got seconds here, but if I were part of the Sun Health at Home and I wanted to go into a CCRC and I chose to go here to the V or Sagewood, I could do that instead of going to the 3 Sun Health communities, correct?
Very much so. Yep.
Wow.
You can go anywhere you want.
I love it. I love it. Truly a community without walls.
Exactly.
Nicole, Barbara, it's great to have you guys back on the show. 7 months after the state closing of everything. You're listening to Health Futures, Taking Stock in You. We got 2 more segments. Stick around. It's halftime. We'll be right back.
I finally had to take the car keys away from Dad this week.
I don't think Mom's been taking her medication, and I'm concerned.
I can't juggle work, my kids, and go look after my parents. It's just too much.
Do you need help taking care of a loved one? Cypress Home Care is here for them and you. Bathing, meal prep, monitoring, errands, and more. Call Cypress Home Care 602-264-8009 or go to cypresshomecare.com. Cypress Home Care. Help is here.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. And if you're just tuning in, I'm your host, Bob Roth, and it's my pleasure to have Barbara Mason here in the studio, and I've got Nicole Holtsclaw here in the studio. They're with Sun Health at Home, and they were just here 7 months ago, and now they're back and doing some amazing things in the community. And I wish you guys were all here for the first half, and if you were, you got a chance to hear some great stuff. And if you missed it, please go up to our website at cypresshomecare.com, click on the media button, third button down is radio show. So we talked a lot about Sun Health. We talked about Sun Health at Home being one of your communities without walls and how portable this program is, which is really exciting. And Barbara, you did a great job of explaining that. But the one thing that we left off in the first segment was we were talking a lot about the stuff that you do in the community, and specifically like your Memory Navigator and certainly the Center for Health and Well-Being. So, Nicole, can you walk us through a little bit about that? And I know there's some other things that are in the works that you might not be able to talk about. Maybe you can talk about, but it's all really, really exciting.
Well, and our program, Sun Health at Home, actually works very closely with Marty Finley, who's our primary memory care navigator. And her main role is for free. She works with families in the community and helps them walk through this process that is ultimately a life-changing, life-altering diagnosis, which is any form of dementia. But I really think Barbara would be the one to really excel in telling you some of those details and what she's been able to do since COVID, because Barbara directly works with her and helps manage that program.
Well, thanks, Nicole. Marty's been with us quite a long time now, and she really is a gifted individual.
Agreed.
Who has a way of communicating with folks that have been diagnosed with dementia or their family members or caregivers. And her primary role really is to identify the supports that are needed to put in place, whether we're dealing with a new diagnosis or as someone is really progressing and transitioning through the diagnosis of dementia, because as you know, it doesn't just stop. And so as Marty begins to develop a relationship with folks and their families, she's able to identify where the holes are, where the cracks are, and how to fill those needs. Now, generally speaking, Marty does a lot of in-person meetings with folks and their families. But through COVID, just as we've had to move to telehealth and things like that, Marty's had to make those transitions as well. What we have found is through people being so isolated during the last 6 months, there have been a lot more people reaching out for help, which we're so glad to hear, because people are not able to get out and take their loved ones out. And so when they're stuck in the house and some of the behaviors or symptomology becomes much more pronounced, Marty has been able to, through video conference, telephones, she does an online support group, a telephone support group. She's still able to meet the needs of folks who are every day struggling with the effects of dementia in the family. So we haven't stopped. And in fact, we've been able to do many of our services online and on the telephone. And in fact, some of our partners through Banner and through Benevia, they've helped us in doing some online memory cafe. And so we're doing everything. We've stepped up our game, so to speak.
Yeah,
Right.
I had a chance to attend a memory cafe that was partnered through the Banner Sun Health Research Institute. And they did a lot of tools, and they really worked with folks who may not even have a whole lot of dementia education. And they were able to make it relatable for someone that may not have a family member that has progressed very far in the disease. They were able to bring up scenarios and they did this one thing, write down all the steps that it takes to brush your teeth. And I was amazed at how many places there is for someone to, step away from those steps and maybe make a mistake somewhere in that process. But it kind of opened my eyes to how much is involved.
And it was all done virtually.
All done virtually.
But which is so important. I mean, let's face it. One of the core centers of Cypress, at least for the last 6 years, is we have an incredible dementia program. And Michelle Cornelius and Katie Cruz, they both do a lot of education workshops, and the support groups are so important. It really is. It's so important to be surrounded by your peers because you feel like you're the only one going through that.
Exactly. And one of the things that I'm really proud personally to belong to, I'm a master trainer for Dementia Friends.
Nice.
And Dementia Friends, as you know, is a worldwide movement in order to educate the population about dementia. And so one of the things that we've done is we've taken our Dementia Friends training and put it online at sunhealth.com.
Makes so much sense.
And so the really nice thing is that we're able to educate and provide support and kind of lead people through what they can expect as changes occur. And that's really the beauty about Sun Health in general, is that we really are interested in fact our mission statement, empowering people to live longer, more purposeful lives. We're really connecting with our community to do just that.
It's interesting. The Dementia Friends movement is phenomenal. For those that don't know, it was really born out of the Dementia Friendly movement. Tempe was one of the first 5 cities in the country that had been declared a dementia-friendly city, and Scottsdale's attempting to get that designation as well, and so many others are as well. So
Surprise
got theirs last year.
it's really exciting, and these memory cafes are really, it's kind of like the heart, the center, the kitchen, if you would, where everybody comes together and looks for support, right?
Yeah.
and they get to know one another, and they truly become friends. I mean,
Absolutely.
it was really amazing. I mean, Katie Cruz with our Cypress, she is one of our care service coordinators, has been leading some of the dementia memory cafes in Tempe since its origin. And it's interesting because we get inquiries because of our reputation for memory care. And I can't begin to tell you how many times Katie knows the family. She goes, "Oh, I know that family. They were at my memory cafe." So it really is a community unto itself.
Right. And one of the things that I'm proud to do for the Dementia Friends movement is to provide these really grassroots training to everyday folks. So local employers, church groups, golf clubs, card groups. We really go in and provide them with just an hour basic training on the communication and really what dementia is all about. And so being able to provide those groups and that education and then train those folks to go out and do the same. That's where we make a difference.
Well, you know what? It sounds very similar to what Sun Health at Home does. You know, Sun Health at Home, you know, you talk about advocate. I mean, you're training people to be advocates and really be alerted to people that might be plagued with this illness and this disease.
You know, and I don't want to sidestep from dementia. You know, the statistics of 1 in 10 will suffer from dementia is a large statistic, being the most growing, you know, disease of our time. But with that advocacy and the communication that you talked about, that's the one aspect of Sun Health at Home I never want to skip over, because it really is what I really refer to, the foundation of this pyramid of services that we offer. Without the wellness coordinators, which are what makes us unique and what makes us successful, they are the cornerstone of everything else. And so that advocacy piece, you know, and that has had to change quite a bit during COVID. You know, the communication and the services we offer has been the same, but how we are doing it has changed. And, you know, from early on, one of the most stark instances that I saw out of this communication aspect was we had someone who had applied with us, and our wellness coordinator said, they are in great health, you know, no issues, get them in the program. There's just this one thing. It's not an issue, but I want to take another look at it. And she met with his physician, and the physician wasn't too concerned. So she took it to our medical director, who said, you know, I'll back you up. And what she had noticed was just this, something on a previous CT scan. And she just said, I don't think that's a normal nodule. And our medical director said, you know, well, we'll work together, order a new one. And she was able to advocate for this new member and fight for additional testing that uncovered stage 1 lung cancer.
Wow. And had the person become a member already, or were they still going through the membership process?
They had just been approved, and that was one of the little things going through his medical records that she just couldn't let go.
Wow.
But it was her fighting and saying, even though your physician isn't concerned, I still think let's just take that precautionary step and get another scan.
I have chills.
I mean,
absolute chills.
And that's really one of a handful of things that we've done with the program and advocating for people. But even members now going into hospitals for elective procedures, having these communicators, these advocators, work with them to make sure that, you know, they're going into a hospital alone. Family members can't go with them right now. So how can we make sure that we can keep those family members up to date on what's going on? And
that is big. And I think that's the biggest thing that we've been plagued with, is that families aren't allowed to go in, and there's nobody advocating for these loved ones that are in the hospital. You know, when we come back, I want to talk a little bit about what we talked about before we got into the show, where people are not addressing their own healthcare needs because of the fear of COVID-19. I also want to talk about what happens if you do go into a care facility, if you're in the Sun Health at Home programming. You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We're down 3 segments. We got one more to go. We got Sun Health at Home in the studio. Barbara Mason and Nicole Holtsclaw will be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, Call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and I've got Sun Health at Home here in the studio. I got Nicole Holtsclaw and Barbara Mason, and we're going to jump right back into this because we're covering some really great stuff at Sun Health at Home. And, you know, one of the things that we talked about in the very beginning, before we even talked to, even before we started the show, was talking about how COVID has affected everything. Mm-hmm. And, one of the things that, I have learned and have heard this from the medical community is that people who are dealing with certain morbidities, whether they be diabetes, whether they be CHF, COPD, they're not going to their doctors. They're not getting in to see their specialists. They're not going to the ERs if they're not feeling well because they are scared to death of getting this awful virus. So I would love to hear what you guys are doing to prevent that. I mean, because you do advocate and you do stay on top of them. So how do you take that fear away from them?
Well, and fear is the perfect word. We've all been afraid during the past few months. Some of that is because we've received really conflicting information and unclear information. But one thing is true: if you have a health condition, it's important for you to follow up. It's important for you to attend your medical appointments, to receive the medication and the care that you need. And there have been a lot of people who've decided, well, I'm just going to wait. I'm going to put this off until COVID is gone. I think we all know that we have been brutally shoved into the future, and it's not going anywhere. We're gaining much more control, but it's here, and so it's important for us to present opportunities for folks to follow up on their health care and to attend their doctor's appointments as they normally would. And that's why telemedicine has taken such a great leap. And really, it's as I was mentioning before, it really is a wave of the future that has suddenly become now.
Sure.
And so the use of telemedicine and video conferencing, that's been a great, significant increase. The problem is that many of our senior population, they don't have computers, or they don't have the ability to, use their iPhone to log into a doctor's appointment. And so I'll let Nicole share some of the ways that Sun Health at Home, especially, has kind of gotten over those barriers.
Partnered, yeah. So when this really first started, a lot of our members had maybe things that they were going to the hospital, and the hospitals have done a great job with triaging. So if you were there for a non-COVID related issue, then they're doing their very best to get you admitted and treated and discharged as quickly as possible. For many people, I've seen within 24 hours or less. And so I do want to commend many of the hospitals in our valley for the work that they've done for those non-COVID issues. But in following up after hospitalization, that primary care physician visit is very important. And for a lot of folks who may be having telemedicine, that's not a normal, just a medication refill or maybe going over blood work. That is something you really do want to sit down and discuss. But for years, our wellness coordinators have been partnering with our members and going to physician visits and being able to advocate in person, and that hasn't changed. What we've done is, if they don't have access to video conferencing, then we're able to connect and do either three-way phone calls or different measures like that to be able to connect the member to their physician for telehealth appointments, but to also have their wellness coordinator involved. Because what we're able to see is, even if there's a disconnect between a patient and their physician, they have another set of ears and another medical professional that's really there to advocate for them, that's able to translate information if they need it, or even just refer to it after the appointment is done. And so it's been a really great asset to a lot of our members.
And it's interesting you say that. I mean, I can't begin to tell you how many of our clients go in to see their physicians and they don't remember what they're supposed to ask them, and they don't remember the instructions that they're getting. Yeah. So, I mean, look, it's important to have those second set of ears and eyes on it so that all of that is translated, right?
Right, and we've had to be really creative, and I give a lot of credit to our program manager, Paul. He's actually gone and taken computers into our members' homes. He's been our IT guru, and he's made some of those appointments possible.
We've helped purchase some, easy to connect webcams that for members who do have what do we call these traditional computers? Our desktops.
Desktop computers that don't have cameras built into them.
Yeah, being able to purchase those webcams, and Paul's able to help train them on how easy it is to connect and how to protect them.
You're like the Geek Squad, Paul.
Yeah.
We're winding down our show here. Real quickly, what happens if you have to go into a care facility?
If someone has to go into a care facility in our program, we have 4 of 5 of our plan options are designed to protect someone's asset regardless of where they receive the care. So that financial protection also stays in play if they go into a care facility. But for many folks, especially under assisted living level of care, we're able to effectively bring that care to them.
Nice.
And so the financial protection is for short-term instances as well as those long-term needs. So whether they need us for a few hours one day or if they need us for 10 years.
Awesome. Well, I want to give you guys a plug. If you want to reach these folks, you can go to sunhealthathome.org or call 623-227-4663. And you guys are amazing. Is there any questions I haven't asked? Anything you want to share as we wind this show down? Any final comments?
Only that Sun Health at Home has managed in the 4 years that we've been in operation to be the fastest growing program of its kind in the United States.
And the only one west of the Mississippi.
Correct. And we've actually won 2 awards for innovation and creativity. So we're always looking to
and you got a big promotion.
Oh, well, thank you. I did. But more than anything, we're here to help, and just reach out.
Thank you, Barbara. Thank you, Nicole. Thank you, Paul. Sun Health at Home, thank you for being here on Health Futures. We'll be back next Friday.
Thank you, Bob.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3